This is the third segment. You're about to get the denouement. This is wellness. Why Cleveland Clinic did it. You've learned that. We did it to get job competitiveness. We did it because we considered it our responsibility to help decrease medical costs. And the only way of doing that, yeah, we can get efficient. That may be 15%. But 85% of what you can do in medical costs is decreasing chronic disease. So that's why we spend so much time. And as I told you before, we've succeeded with our own employees. I'm going to show you some examples of what's next and what we've done. And we usually do it with our own employees first. This is one example. We did it with patients and other employees first, and now we're bringing it back to our own employees. What is it? It's unmanaged stress. I want you to take a close look at the data on it when I show it to you. In 1980 to 1983, when the perceived stress scale, validated scale, was developed, the average stress in America on a scale that goes up when you have more stress was 12.1 for men and 13.7 for women. Look at what it is today. Don't look right away. I'm going to show it to you in a few seconds. But I'm going to show you, I'll tell you right now, the average stress in America for all the employees we've looked at is now in the exceedingly high stress, 5 standard deviations from the norm in 1983. That's what our employees are living with, huge stress. And we will have stress. You can't do away with it. But whether it ages you, whether it causes chronic disease, you can largely ablate by learning how to manage it. So that's what's next up in our employee population. The Interheart Study showed that stress was as great a cause of heart attack as is smoking or diabetes or hypertension or obesity. And it isn't just some nammy-pammy, sit under a pyramid thing. This is real, what the patients are feeling by this validated stress scale. And it probably has a greater and faster return on investment. Now, we didn't do it here first because we had said we give stress to our nurses. If a nurse is caring for 4 patients in the ICU versus 2 patients, because we got more patients all of a sudden, she's got to buck up to that, we said. That's an old philosophy. Wrong, wrong, wrong. We've got to learn how to help our employees be engaged, really want to come to work, bring all they can to work, and that's by managing stress. So this is the stress scale. We did this in a 4-part series. All I want you to concentrate on is the light blue on the far left and that green, because that green is what really works. It's an online program, and you can get a peer group to do it. You can do it yourself, or you get 12 people together in a room for a corporation, and I'll show you how well that works, or any group. That light blue, you see the level is 23? That's exceedingly high, very high, but that 23, that's what the employees are living with. It's a 6-week program, but after, if you will, 8 weeks, notice the green, it has a great decrease. And after 16 weeks, it's only a 6-week program, but many of them kept practicing on their own, they have about a 40% or more decrease in stress. And they bring more vitality to their job, a more than 50% increase in their vitality level, MOS outcome study measure. Managing stress fosters employee engagement and allows your group, your employees, to bring more vitality to work, your hospital to bring more vitality to work, even you to bring more vitality to work. The data is from historical studies, but we've now done, it says 4 randomized controlled trials. I got news for you, it's now 7 randomized controlled trials in diverse employee groups. I should have updated that slide. And what happens with stress management, and this data is gene arrays, and as you can see in the N1 picture from another study, this is in fact a different group of genes are on pre-stress management than in N2 and M, where they're managing stress. They turn inflammatory and genes that promote obesity off and turn on genes that promote health. Remember, all genes do is make proteins or watch other genes, and which genes are on appear largely under your control. So, what would I do? The biggest for employee and the largest cost impeding productivity is unmanaged stress. So that's what we do. And we do, anytime 5 or more Cleveland Clinic employees will get together, we provide a yoga instructor for varies from 20 minutes on our nursing units to an hour for after work activities. What could we be doing for our communities, employees, patients, visitors that we're not yet doing? Well, we're going to bring a wellness widget, which I'll show you in a second. But first, let me go back over stress. When you look at the real age effect of stress, yeah, blood pressure is a huge thing. Bring blood pressure down to normal up to 25 years younger. 8 to 12 years for cigarette cessation. The real age takes into account both disability risk and death risk. Nutritional choices, 27 years. Patrolling your own health, getting physical checkups, getting the prevention you need. But stress is the largest ager, up to 32 years older, if you've got a lot of stress in a 1-year period and don't manage it. Here's another study. Stress scale, you see they were around 23 to begin with. Again, a huge decrease, a 38% decrease in perceived stress with this study that was done at GE Aviation. Another group, pre to post, 77% of respondents saw significant improvement in their stress scales pre to post. 38% increase in their feelings of emotional well-being. These are the questions we asked. An 18% decrease in work burnout. A 45% increase in the vitality and the energy these people bring to work. And yes, 69% of respondents moved their vitality to a healthier vitality. Do you have anything you can do that's 6 hours long that radically changes health for the next year? A stress program does that and did that. That's how powerful managing stress can be. And people are satisfied with the program and continue to use the tools. So 35% decrease in perceived stress, and the people who are most stressed get the most improvement. So what have we done? We've done education for our staff, for our patients, and now for our communities. And the wellness widget is our next step to help you and help all them. The reason I'm bringing this up now is because it is something you can use in your EMR, or you can adopt or adapt to your EMR, electronic medical record. It's a combination of a lot of institutes at the Cleveland Clinic, wellness and medicine, but with a lot of help. And it's 6 questions or less in each of, we started it with 4 big areas, now it's 6 areas. It involves sleep as well as depression, and 30 seconds or less of MA or time and less for a physician time. Amazing thing. I watched it roll out, giving these iPads. You can do it on your iPhone, your Android tablet, your MyChart at home, whatever you want to do it, a web at home. But I watched these people over the age of 70 doing an iPad. First time they had touched a computer. 90-year-old lady. After she was finished, she did the whole thing in under 4 minutes. I timed them, sitting there and timing 7 people over the age of 65. No one took more than 5 minutes. And after this person, I asked her, had she used a computer before? She said no. She said, but I want to buy that one. That's a great computer. We're now a sales place for some tablets. But in any case, the key point is that what it does is it asks questions, it gives them a score, gives them education related to it. It can pull data from the EMR into this form to give them better scores and better recommendations for then what they do, both better education, and then it refers them to appropriate places to do things. This is the, if you will, theory of it. This is a nutrition, if you will. But what can we do for our communities, our employees, patients, visitors that we're not doing now? Well, we also have physician consults in integrative medicine. So in these things, 1 hour with a doc talking about diet, stress management, physical activity, and other lifestyle items, including supplements. 1 hour, if you will. We also have programs that have a 1-year limit on reversing cardiac disease or intensive cardiac rehab on the, if you will, program that either Dean Ornish has or one we derived, if you will. And you can call Lifestyle Med at ccf.org if you want to learn more about it or to refer patients to it. We have a weekend executive program like it, and most insurance calls it. It is nutrition education and cooking. We actually get the patient learning how to cook. Most patients don't know how to cook, so they can't eat healthy. Monitored fitness, stress management education, and support groups. So, what do we have for our own employees? Tobacco cessation, if you will, an employee assistance program, Go Foods, Go Food for You, an online program, fitness centers, classes, Weight Watchers, Curves, Way to a Healthy Weight, Enforcer e-coaching, Shape Up and Go, yoga, Stress Free Now, an oral coaching program. We have wellness tips and wellness events. Anyone can find out about all the things that we in the Wellness Institute have done and what we've done for our employees, what we can do for your patients, what we can do for your practice. It's at clevelandclinicwellness.com website. And this is what the website does. It's not perfectly easy to negotiate, but it's clevelandclinicwellness.com. We're making it easier to negotiate. We realize it's not perfect. And by the way, on supplements, there's a pro-con debate. I think this one is on iron deficiency anemia. But anyway, there's a pro-con debate on supplements in the supplement evaluation. What's available for anyone? You can email us, wellness@ccf.org, fitness centers, fitness@ccf.org if you want to find out more about that. The yoga that is done 50 to 60 classes, yoga@ccf.org. And in general, go to clevelandclinicwellness.com for the website. Remember, you deserve world-class care. Your patients deserve world-class care. Wellness is part of that process. Thank you very much.